Hello and welcome back to the Brain Boost channel. So today we're going to be continuing off of one of our last videos on sleep and talk about sleep disorders. So let's just get right into it. So we're actually going to start off with insomnia for this video, and I know most of us probably know what that is to some degree. So insomnia is the most common sleep disorder that we see, and it's obviously the inability to fall asleep. Most of us know that definition. And actually 25 to 30% of people have occasionally experienced insomnia, whereas 9% of people actually suffer from it regularly. So there are different types of causes for insomnia, like stress, could be substance abuse, a mental disorder, caffeine, we know that one for sure. Excessive napping, taking a nap at 6 p.m. till 9 p.m. is obviously going to push your sleep in the night to way later. And there's also looking at screens. I know we see this one a lot online, talking about, stepping away from your phone a bit, like an hour or so before bed. Okay, so moving on to the different types of insomnia that we can have. So we can get something called conditioned insomnia, and basically what that is just essentially it's when you sort of learn, so to speak, the insomnia. So, when you go to bed and you associate like going to bed without being able to sleep. So then every time you go to bed, you find that you can't sleep and you think you have insomnia. So that association is kind of what makes it called conditioned insomnia or learned. So there's also idiopathic insomnia, and this is an onset of insomnia during childhood. And this is a neurophysiological abnormality in your central nervous system. So this begins in childhood and it's actually experienced through adulthood. And this form of insomnia is actually more resistant to treatment. And also, diagnosing insomnia in kids is actually quite difficult because, it's common for a 3-month-old to wake up several times during the night, but obviously it's less common for a 7-year-old, for example. So sleeping definitely fluctuates with development, which is what makes it a bit hard to diagnose in children. So let's keep going. So we also have hypersomnia. This is just a medical term, but this is when you're very, very sleepy. So, for example, if, you didn't have a proper sleep at night, you have poor quality of sleep, then you're probably going to be very sleepy during the day. If this happens often, you're going to be kind of always sleepy, so you have hypersomnia. So there's also something called sleep apnea. So this is just a condition where oxygen intake is reduced. And this is for obviously small bouts of time. And here I have written up to a minute, as you can see here. So your breathing is obviously shallow, and you can even stop breathing for a short period of time, obviously, like I mentioned there. And your blood oxygen actually decreases. So then the sleeper awakes, and then this is basically what happens throughout the night. And you can treat this, or you can try to help this, I guess, with wearing a CPAP or CPAP mask. And this is what pushes pressurized air through the airway, so that helps you, helps your breathing during your sleep. Okay, so next we have narcolepsy. So this is, as I have written here, a disorder that's caused by sudden and extreme need to sleep. So it's essentially an uncontrollable sleep attack. And this could last, it could be a few seconds, could be a few minutes. But upon waking, you do feel refreshed and alert, almost like you've had a nap. And so actually in its extreme form, so in an extreme form of narcolepsy, you could enter REM sleep. So be sure to check out my other video on the stages of sleep to learn a little bit more about REM or REM sleep. But you can enter REM sleep in a very extreme case, and you can also, lose all your muscle tone, which is quite freaky, to be honest. And we have something called cataplexy, which is a second symptom of narcolepsy. So this is where you, like I have written here, you get paralysis during your waking hours. So paralysis that's actually initiated during REM sleep is done at inappropriate times. And in this cataplexy secondary symptom. And cataplexy is actually initiated in emotionally enraging events. So something that will really engage your emotions. So arguing, laughter, even sexual activity can really engage your emotions, and you could actually start, undergoing or experiencing cataplexy if you have this. So that's it for today's video. Be sure to like and subscribe to the channel and comment if you have any other topics that you would like to see from the Brain Boost channel.